Hi, thank you. I am Dr. Elizabeth Tighe. I am an associate professor at Georgia State University in Atlanta, Georgia in the USA, and also I'm the assistant director of our Adult Literacy Research Center. I'm going to be talking today about some work funded by the U.S. Department of Education on different profiles of engagement on a health-themed PIAAC literacy item, and then also talking a little bit descriptively about some of the differences among the profiles in terms of demographics, their skills use, so tying into practice engagement theory, as we've heard, and also by literacy performance. I first would just like to acknowledge the 2 grants from the U.S. Department of Education that have funded this work. And I'd also like to provide you sort of a broader scope before I get into the study of what we're looking at. So we're really interested in using process data or the log files that goes along with PIAAC. In our first grant, we've done sort of extensive work looking at the log files related to literacy, numeracy, and problem-solving in technology-rich environment items. And why we're looking at this is because our focus is really on understanding adults with low skills. We use all the literacy levels because we like to compare to see what a proficient adult might look like. But at least in the US, we know that many adults have limited literacy skills, but they also have challenges with digital skills. And not just digital problem solving, but basic ICT type skills, clicking, highlighting, as they move through items. At least in the US, for our adult literacy programs, they have to complete digital assessments to get their high school equivalency degree. And so these are sort of assuming that you at least have the basic digital skills to perform well on these assessments. And we also know that a lot of digital assessment and materials used in adult literacy classrooms aren't necessarily designed with adult literacy students in mind. So this is why we're looking at the process data to understand how these adults are actually engaging with different types of assessment items. And so we're looking for basically potential strategies and ultimately to understand sort of challenges and design, hopefully, more equitable assessments for adults with low skills. That being said, for this particular study, we are using the US PIAAC Literacy Cycle 2 sample. In the US, about 28% of US adults are at or below level 1 in literacy, which if we think about US in cycle 1, it was about 19%, so this is a much higher rate. And to better help adults enrolled in literacy programs increase their skills, we need instruction to not only focus on literacy and foundational skills, but also, as mentioned, practice engagement theory, the idea that different skills use in daily life can translate to better literacy performance. And so in this case, we're working with a health item, since part of the theme here is well-being and health. And since the PIAAC literacy domain is very broad in terms of the type of items, a health item would sort of classify as a daily life skill you might need. So navigating labels, instructions, and health portals. Why process data? So in adult education programs, instruction, progress monitoring, and also class placement is often driven by digital high-stakes assessments. And usually we get sort of total scores, or you might get correct and incorrect responses on these tests, but it doesn't always capture the complete picture of where an adult might have challenges completing the different items. And so process data can give us a little bit more about how adults might engage with these different items. Now, unfortunately, in the US, I have very limited access for cycle 2 to process data. There's sort of different types. And in the public use files, which is what I used for this, it's more aggregate level process data. So things like total time spent on the item or total number of actions. Whereas in cycle 1, some of the work we were doing, we actually were coding out every single action sequence and looking at patterns through all, say, the problem-solving and technology-rich environments. So today I'm going to talk more sort of higher-level process data. But there's been some evidence from adult literacy programs where we've tested out reading interventions to suggest that adults engage differently. So some might be slower, some might be more conscientious and move through in a more deliberate way, some sort of skip through different materials. And there's also evidence from PIAAC Cycle 1 from my colleague who's actually here today who wrote a paper to say that adults with low literacy skills across all of the testlet that we looked at for PIAAC literacy spend less time, regardless of the item difficulty, than adults with higher literacy skills. So for today, we're going to talk about a health-relevant literacy item. I'm going to use the aggregate level process data to hopefully try and unpack engagement profiles based on these different process datas. And then I'm going to talk a little bit about differences by demographics. We've used a number of demographics because in the US we know adults with low literacy skills are a very heterogeneous group. Unfortunately, the public use files doesn't include all of the ones we would have liked to include, but we're including age, educational attainment, and self-rated health, as these have all been found to correlate with literacy performance. We're using skills use, reading, writing, numeracy, and ICT. We're using these at home because many adults with literacy skills are not employed, and so you get a lot of missing data when you look at the at work, so for this one we did not. And then also their literacy performance. The particular item we used was called Medco, and so the sample size is about 3,700. You'll see there I am classifying several different categories as low literacy. And so we have about 10% below level 1, 17% at level 1, and 29% at level 2. I keep them as separate levels, but I put level 2 there because really to meet college and career readiness standards, you have to sort of be at a level 3 in literacy, and I'm going to put up a reminder of sort of the descriptors for what the different literacy levels look like. And then you can see the demographics at the bottom there. So if we look at PIAAC literacy levels, what we see is for level 2 requires low-level paraphrasing. So clearly a level 1 adult may not have the basic foundational decoding skills needed, but at level 2 they may have those, but they're sort of doing very low-level inferencing. And so again, they're not meeting the standards we would expect to be proficient in literacy. And so we look at that group as well, and we see differences between level 1 and level 2. The item we're using is Medco, and we're using question 2, so it had 2 questions. Unfortunately, since items are restricted, I can't show you the actual item, but the context here is it's an aspirin medicine label, and it has multiple paragraphs. But similar to the mock item that PIAAC does let us show, the interface would look something exactly like this, just in medical labels, and it asks them to highlight 3 situations for which you should consult a doctor. So just like in this preschool item, this one only had 1 highlight. There would be several different places to highlight. And one of the reasons I chose question 2 over question 1 was because they had to highlight 3 things. And so there'd be more actions and possibilities for those types of things. And then once they select their answer, they just have to commit the answer down here. So it's a pretty simplistic item compared to some of the more problem solving where they might navigate different texts in different environments. For those interested in the process variables, these are all the ones that we use that were available. So total number of actions, total time spent on the Medco item in milliseconds, number of times the item was visited. We calculated what we're calling the relative hesitation before starting the item. So they have a time to first action, which presumably, since I wish we had eye tracking data to see what they were looking at, but presumably they would have been in the item reading the prompt, and so it's that amount of time until they made any click action within the item. But what we did was we wanted to know relatively to their total time, how much time did they spend before they made an action? So we divide time to first action by the total time. And then we also calculate what we're calling speed, or how quickly they were clicking and highlighting in the item, which is simply the number of actions divided by the total time that they spent. These were sort of the demographic variables. These are pretty consistent with how they were coded in the data set already. The only thing we changed was we don't see a lot of differences by 10-year bands, so we collapsed to just younger, middle, and older. We typically, for educational attainment, talk about high school or less, some college, and then college degree or more. We kept all of the self-rated health categories, and then we just used the derived indices for the reading, numeracy, writing, and ICT at home. We may in the future and have in the past looked at single items because some of them are more or less relevant to adults' lives. But for this, we kept it simple and just did the derived. Okay, so results. So the first thing we did with all those process variables was run a latent profile analyses. Based on the model fit indices, we found that there were 5 distinct profiles or behavioral patterns for these items. So I put up here a heat map. I'm going to try to walk through a little bit of what we see. So the first group we're calling the early exit group. It's about 200 of our adults. And the first thing you'll probably notice is they have an accuracy of 0%. If we look at the heat map here, they only spend about 8 seconds in the item. And they have very few actions. And they also have a very low hesitation, meaning that they basically just go in and exit out of the item immediately. Profile 2, we're calling the hesitant minimal groups. This is about 700 adults. Accuracy is a little better at 30%. They spend longer. They spend about 36 seconds. But what you'll notice is this red piece here, which is that relative hesitation piece. So presumably they're spending a long time hesitating on the item, but then the minute they make a click, they're done because they don't have very many actions. The next group is what we're calling rapid exploratory, or I also like to think of it as the rapid clicking group. Because if you look at this dark red here, this is the speed, which is basically how many clicks highlights divided by the total time. So they are just sort of clicking around within the digital environment. They do spend longer, 54 seconds, and their accuracy is a lot better, but it seems almost like trial and error, right? Clicking through the item. Profile 4 is what we're calling the direct routine group. This group spent, beyond the hesitant minimal, the most amount of time in that relative hesitation phase. So presumably they sort of read the item, looked at the navigation screen, but they didn't really make all that many actions. So they seem to have some kind of routine to how they're going through and answering the item, and their accuracy is second best, and this is a large group, about 1,850. And the last group is what I'm calling deliberate exploratory. This group here had a large number of actions, but relatively spread across because they spent the most amount of time, 80 seconds. We don't see that same hesitation period, so it seems like they are going through and making clicks within the environment and sort of testing out the environment, but in a more deliberate way than just my rapid clickers that are going through faster, and their accuracy is much better. So we then just sort of looked at some preliminary descriptives by the different demographics. So age, my early exit and hesitant minimal tends to be a little bit older skewed. Successful engagement draws really from all ages, but what was interesting is those rapid exploratory rapid clickers here tended to be a lot younger. For education, probably unsurprisingly, the early exit group, overwhelmingly about 77% of them had less than a high school degree, and they had the lowest level of college or higher. It was more mixed in terms of the hesitant minimal and rapid exploratory, but still about 50 to 54% of those groups had less than a high school educational attainment. And then those 2 top groups that had the best accuracy, direct routine and deliberate exploratory, also had the highest educational attainment. In terms of self-reported health, the early exit and hesitant minimal had 28 and 23% of the self-reported fair and poor health. And you see that decreases to 21% as we get into the sort of rapid clickers, deliberate exploratory, and direct routine groups. In terms of skills use at home, what you'll notice is the early exit group has the lowest self-reported skills use in all of those domains, so reading, writing, numeracy, and ICT. The hesitant minimal group has lower home skills use in ICT, numeracy, and writing. The rapid exploratory seem to have the greatest spread in skills use. We can tell by the confidence intervals here. So it's sort of a mixture of those who self-report lower and higher frequencies across the different skills use domains. And then the other 2 groups look identical. They have the highest reported skills use overall. The reading, which is the blue, tends to be the most frequent, and the writing tends to be the least frequent. And then finally, descriptives by literacy skills. So if you recall when I had that chart up for the literacy, you've got the literacy levels, but then also we know it goes 0 to 500. So if we look at the medians then and map these onto the levels, the early exit median is well below the other 4 profiles and falling at a level 1. The hesitant, minimal, and rapid exploratory, these fall into a level 2. And then the direct routine and deliberate exploratory are a level 3 proficiency. So a couple of takeaways. So we see that adults are exhibiting varying strategies in how they're approaching this health-related PIAAC literacy item. And this is interesting because it's a relatively simplistic item. It's a single static screen. There wasn't that much text, and there weren't that many actions that you could actually take, and yet we're still seeing a lot of differences in just that item. The literacy level and also their strategies seem to be directly related to how well they're performing on that item. We also see differences in demographics, skills use, and as I mentioned, literacy. And adults with lower literacy levels tend to have the lowest skills use at home across all domains, self-rated poor fair health, and also lower educational attainment tend to be in the early exit and hesitant minimal groups. So hopefully I've illustrated to you some of the exciting things that we can do with process data to better understand how respondents are navigating digital items. What's next for us? My hope is that we will get the cycle 2 problem solving, because the new grant is actually really cool if we get it, because we're going to be not only using the adaptive problem solving, but we're actually hoping to get the items, and we're going to be administering the items to our adult literacy students in Georgia, as well as more proficient college students as a comparison group. So that way we can get eye tracking data, because process data really can't tell us everything. And we're also working on think alouds, where we can see cognitive and metacognitive strategies as adults are working through the items. So hopefully that will be something we can do. Thank you very much.